second question that I get often from Realself is how much fat is needed to be able to do fat transfer. And it is true, you need to have fat to be able to transfer it. And so that fat is removed, like I was saying before, using a gentle method. Typically I use a water-assisted device, and that's because the water causes the fat to gently come into the syringes without leaving any of the tubes, and so I don't have to worry about infection or worry about manipulating the fat. The fat comes out and it's ready to go back in wherever I want it to go. You need a certain amount to be able to get lift and contour. For the buttock area especially, much more volume is needed than something like the face or the hands. Or the feet, or even the vagina. There's areas that people have loss of fat over time, and it is important. I see a lot of women post breast reconstruction where the nipple area is a little indented. Sometimes fat is needed to be re-injected to reposition. So there are many options of how to use the fat, but only small amounts are needed for areas like that, those smaller areas. Larger areas like the bicep, shoulder, chest area, and buttock will require much more. And so if you don't have a lot of fat, going and eating a lot of McDonald's or getting overweight sometimes isn't going to be the right option for you. It's not healthy, and it also only makes the fat cells get bigger. It doesn't increase the number of the cells. And so even though you may feel like you're fatter because you went and tried to gain a bunch of weight, it doesn't overall change the amount of fat that we can transfer. They're just larger cells that will shrink in size when they're re-injected to another area. So you want to be your natural proportion. You want to be at your natural weight. The best candidate for something for transferring is somebody that has localized areas of disproportion, meaning that their flank or their back or their legs or their stomach has a large amount of fat that with exercise just doesn't go away, and we can then remove that by harvesting it and having a good amount of pure fat, gentle extraction using PRP, which is your own growth factors, to enhance the fat transfer and then supplying it to an area. So I can't really put a number on it, but in general for something like the face, it's maybe 10 to 20 cc's. What that means is a very small amount. Same thing in the hands. But if you're doing something like a buttock, we're talking about 300, 600, 1,000 cc's. That's close to half of a 2-liter bottle of Diet Coke. And that means that you need much more fat. And this isn't just the amount of volume you have. In the volume you have in the area that's being tried, there's also connective tissue, there's skin. So when you do liposuction or harvesting in an area, only a proportion of that fat that's removed is good for transfer. So even though you might have some fat, you might not have enough for fat transfer. So that what is important is that you go to somebody who is an expert in both lipo contouring, body sculpting, and fat harvesting, somebody that knows how to take the fat and prepare it and then re-inject it and can follow you over time to ensure that it stays.